right before we start the dressing change and the Trach Care, right? So we're not going to do that here. You'll do that over at Joey's station. So here we go. What am I doing? And I won't delay any process by talking. I'll just add to that. Okay, so I've got on just clean gloves. And I want to assess my site for my patient. They are on oxygen. I'm going to lift this off. Explain what I'm doing to the patient.
And the regular, so it's not as if,
look at my dressing, it's not too bad. Look at my site to see how many Q-tips I might need to get ready. And I'm going to dispose of this in the trash, which is at the bottom of the bed, so let's say that's the trash.
We can turn this mannequin into an inline. So I just want to be clear on that. Each one has an ambu bag as needed.
Kits are all a little different, but they generally have the same basic components in them. There's gloves. Remember, it's sterile inside here. I'm going to set my gloves aside. I'm going to pick up my drape.
So I know you don't like
There's no corners visible. I wish there were. Shiny side up or down?
I'm going to have an assistant.
Down, very good.
Just gently
hold on by the corners. Two choices. You can use this as a sterile field, or you can put this right in front of the patient. I'm going to use it as a sterile field. If you put it here, you can't use it as a sterile field on the patient's chest, okay? So, did not plan ahead too well. I'm going to dump my tray ingredients without spilling them.
Yep, I got section. So there's a couple different ways. I'm going to hook this up right here, right now.
Contaminated edge.
Making sure I don't.
I'm going to pour my saline solution. If there's a lot of gunk in there, you may notice we're going to pour that off if it's already been opened. You may notice that we do a 50-50 solution of peroxide and saline if there's a lot of gunk. The standard currently, though, is saline. I get ready to do my care. Always the potential for splashing.
Do you want us to set this on the sterile field like you have, though?
You can do it whatever way you want as long as you follow principles, okay?
Okay.
If you start fogging up, if you have glasses, you just need to tuck your nose a little tighter here. Do I need to hyperoxygenate the patient before I change the inner cannula?
Yes.
Why?
Because it helps them to reserve the oxygen.
If I'm going to keep them off oxygen a long time, and if they're very oxygen dependent, yes, but otherwise we don't need to. Okay, that would be for suctioning that you'd want to hyperoxygenate them before and after. Okay? So, of course, all the explanation to the patient. We've got the sterile hand and the unsterile hand, okay, the clean hand. I'm going to use the trach mask. If you can just keep it down below, that would be okay. It's not very convenient because you want them to have the blow-by. I'm going to stabilize the outer cannula, pull out the inner cannula, and put this back over so they get their oxygen. I'm going to look at how much goop is in here, and one of these is going to be clean and one's going to be dirty. So I'm going to make this one, it shouldn't be on top of my field here like this. I'm going to make this one be the dirty one.
Ready to go? Okay. Quickly in. He starts coughing. I'm suctioning. I'm rotating my catheter.
Let's see. These are my sterile hands. This is going to be my unsterile. I'm not going to touch inside the tube. Be really careful if you're using this kind of bottle brush, especially if you don't have a mask because it sprays all over the place. Got all the gunk out. I'm going to come into the rinse.
And then I'm going to rotate.
I'm going to rinse
as I come out.
any gunk left.
Hands are staying really close.
I'm going to tap the water outside of it, and this is sterile inside. Don't have to dry it off. I'm going to come back over here, and I'm not touching inside the tube. This is all outside.
And it's just a...
There's little wings here. I'm squeezing so it's locked in place.
Double check a pulse for me,
Okay,
please.
now I'm going to clean the outer site for the patient. I have Q-tips, and I decided there was enough in this kit for me to use. This is still my sterile hand. Not the dirty one. I'm going to put it in a clean one. You should keep a couple wet, couple dry. You may have to use gauze instead.
There we go. And
Oh
we'll put a
my
little something on
gosh.
your mouth. And
Dressing
get up my pen light, take a look in your mouth.
I'm going to do this after my hands are both contaminated. So first I'm going to go ahead and check their incision site. I have one more here, but here's my second dry one. So I'm going to stabilize the flange with one finger so we don't pull the tube out. I'm going to take my moistened Q-tip. I'm going to go from the center out, discard, come to the other side, wiping and twisting. If I need one more, sometimes you need a lot more. If they're really crusty, you need to open more Q-tips for yourself because you don't want to be going like this, right? Use a dry one.
That could be an indication that you're not getting quite enough oxygen. So let's take care of that. When I say let's, I get it.
How you doing?
Seeing the black thing outside.
So now I'm going to put my dressing in there. And to do the dressing, we're going to fold, this is my sterile hand, fold these two flaps down.
Fantastic. I'm going to check the pulse, just to get a baseline. Okay, here we go.
Keeping the flange stable with one finger. Put this here. I'm going to try to tuck these edges up. Now, if you need to use other utensils, feel free.
And all the way.
We don't want to drag it across all the skin
The black
because we
thing is
want that to
visible.
be a nice
Okay,
sterile
take some deep breaths.
surface.
I know that means your eyes tear a bit. I know you have that blown pupil on the left, but try to keep up. Your heart rate went up a few beats, not too bad.
Okay.
I can still hear some gurgling.
Now I'm going to change the trach ties for the patient.
One more time.
This patient has old-fashioned trach ties. So I'm going to do a 1/3, 2/3 split.
Coughing. Okay, now.
I'm going to
there's
take
gunk in here, so we need
about
to
an
measure
inch
that
down. I'm going to cut a slit. Lots of frayed stuff. This is why we don't like to use these. We like to use the Velcro kind, but you're going to learn how to do these anyways, because you might have to do that.
Now, I would love to use
So this patient currently has a knot on this side. So the short tie is on this side, so we want to alter that. So I'm going to put the long tie on this side so that the short tie ends up on that side to reduce any pressure issues.
where's my section?
So I'm going to take the non-frayed end. I'm going to run it through without pulling the trach tube out. You may have to use your hemostats for this.
What do I do to make sure that my suctioning has been effective?
Yeah, you can see why they don't like that frayness
Yeah,
right there by
because you
the,
could inhale
get
it.
it in there.
Right.
That's why most hospitals, that's why most hospitals have this. This is Sinchi.
Sometimes they come with pre-cut, which is really nice as well.
Actual demo.
But even nicer are the Velcro.
It would be smooth. Why would you?
What am I not taking off?
The old ties.
Right, why is that?
You get cough out or something.
Yeah, that's exactly right.
We'll get better at things.
It flies out sometimes.
It does, and then we're in really bad trouble with our
If they
patients.
have a cough, I think they're kind of safe, but they don't have, but they have a cough.
Any questions?
The cough is bad in terms of them coughing out the trach tube. Right now it's secured really well.
Or 10.
Now this is a common thing is that you guys don't tie it tight enough. Now I know it's a mannequin and people are much softer, but this needs to be so snug that you can only fit one finger underneath it, okay?
So is this a wet or
So
dry?
really snug.
Excellent. So I put it right next to. Then in the middle.
And just a square knot.
Valves.
Apparently I'm going to be cradling my patient here because I should be on the other side.
Goes in there for all students. So what if one of these
I'm going
items.
to check. It's positioned pretty well. And then I'm going to be very careful
So we need it all the
to
way
cut
in.
the old
So
trach
that's why
tie, not the new one.
If you start here, because very likely that's the problem. So here, if you've never seen controlling gauze, like that. This is a mobile chest drainage unit, so they can get up and get around. And look at this. It's
Being careful not to get any of that prey anywhere.
visual learners.
I'm gonna trim these extra.
Okay, but then if I, and that's just because it's not being in a person.
Here's my other secondary one over here.
That's right, dry suction. You see a, very good.
If this patient has a brand new trach, just know that all of this movement is very tender for them.
Which is why it's.
Okay, and I'm done with their trach care. Okay?